Hi guys, so right about now I want to show you how to check if you do have a diastasis recti. And what is a diastasis recti? A diastasis recti is also known as rectus abdominis muscles, and these are the muscles that run at the front of the abdomen. So you have them on the left and on the right side of your abdomen. Okay, now these muscles are also known as the six-pack muscles. I'm sure that you've heard of six-pack before. Okay, that's what it actually means. What happened is that when a woman becomes pregnant, the weight of the baby begins to impact on these muscles. Okay, we also have a tissue called the linea alba. Okay, this linea alba is like an elastic band. So as a baby begins to grow in size, the linea alba increases, it stretches out, as a matter of fact. Okay, and when this begins to stretch out, this is just to accommodate the growth of the baby, but it's elastic in nature, in the sense that as soon as you put to bed, naturally it should come back together. The muscles, the linea alba collapse and the muscles come back together. But we have some cases whereby the linea alba is stretched beyond its elasticity point and is unable to come back properly together. So when that happens, it causes a separation of these six-pack abs. So there will be a separation, and that is what is referred to as diastasis recti. Okay, so there's going to be a kind of gap in your stomach, and this gap is not good. Some of the common signs is that you will see a bulge, a cone shape when you try to strain your stomach, a kind of cone shape bulge on your abdomen, your lower abdomen. You also have a pot belly, and for some women, they look pregnant even after months and weeks after delivery. They still look pregnant. That's because the linea alba did not come back together. Okay, so there's a separation of these muscles. This causes it to look like a push or a bulge on the lower abdomen. It's common with pregnant mothers and also postpartum mothers who have put to bed and have not been able to recover their body properly. Okay, so there are a few things you can do to check if you do have a diastasis recti. There are a few things, just a few steps you can do. You can actually check by yourself to know if you do have a diastasis recti. I'm going to show you that right after now, but I want you to know that peradventure you check and you see that you do have a diastasis recti, you can check up with your doctor to actually confirm it in the hospital. There are a few workouts you can do to be able to bring it together over time. But in worst case scenarios, in worst situations, you may need to go for a surgical operation. Okay, and also I'm going to teach you some of the things you can do to avoid a diastasis recti during your pregnancy and after your pregnancy, because we are here to ensure that you're okay as a woman. Okay, so that is what we do in Nigeria. This is Igwe Neneto here. I'll see you right in a moment. Bye.